about 17 months old. One day he was a healthy, happy toddler, and the next day he was kind of limping. It came clear to me the next day after that you know, when he wasn't walking and he wasn't using his leg, that something was definitely wrong.
Unfortunately, Jaysen, when he was a baby, suffered an infection in his spine, and it permanently damaged the right side of his lower extremities, his right leg. It not only affected the length, but also affected the girth, the muscle mass, the function of the leg in general. He has worn a brace his whole life, as well as lifts, basically big blocks underneath his shoes, so he would have even heights.
When we went to gym classes, we had to run around the thing for 6 minutes. And I always was slower than the other kids.
The difference in his legs is 6.5 centimeters or closer to 3 inches. The original orthopedic doctor that we were seeing had referred us to Dr. Ruggles.
Fortunately, Jaysen had was a very good candidate for the rod because of the shape of his femur and what we needed to, how much we needed to lengthen.
We told Jaysen, we said, you're going to feel like you've been asleep for 2 seconds and you're back in your room with mom and dad. I said, we're the ones who have to wait, you know, the 4 hours, and it was a very long 4 hours. The idea is that they put this rod through your bone, in Jaysen's case it's his femur bone, and there are opposing magnets in the rod that will push apart to cause the rod to expand. And then there's a magnet device, almost like a remote control, that you set on top of the leg, and when it's turned on, it activates those opposing magnets to lengthen.
The first advantage of the internal nail is not having to use an external fixator, which immediately cuts down our risk of complications significantly. It's typically a painless process for the patient to lengthen their limb. It's very easy, very user-friendly. We've found quicker rehabilitation in these patients, and patient satisfaction is certainly a lot higher. Jaysen's surgery went wonderfully. Within a week was doing physical therapy, and we started lengthening, and he's done wonderfully along the way.
Help me move you as much as you can.
The process the patient goes through is to lengthen their bone typically 1 millimeter a day. So Jaysen had 40 millimeters or 4 centimeters of lengthening, so it took him 40 days to complete his lengthening phase.
But they're also doing measurements to see how much he's able to bend his knee, how far he's able to rotate his hip, bend his ankle, just different things like that. And then, the first part of therapy is just to keep his muscles and his ligaments loose, because as the bone's lengthening, so are the muscles and ligaments.
Jaysen will have a continued lengthening discrepancy as he gets older, and we may opt to do a second lengthening of his tibia bone, or we may do a different surgery to slow down the growth on his other leg.
I want to play football and go tubing and swimming and get back into basketball and play soccer.
The surgery has just opened so many doors for him for his future. I mean, it really is a life-changing surgery.